Thank you for watching this video. My name is Yadi. I represent Eastern Traditional Healing Arts School and Charlotte AcuBodyWork Clinic here in Charlotte, North Carolina. I don't like long videos. I haven't shot a long video in about 6 years. This is going to be a long video and I'm not going to waste your time. I believe that this syndrome is the most identifiable way to predict disease. I'm going to share it with you now so that you may live a happy and healthier life, that you'll be able to see things coming before they make you sick. Or if you're already ill and you've been fighting a disease for a long period of time, have a way to measure your progress, or at least be able to take this conversation to your doctor, to your primary care physician, to your acupuncturist, to your chiropractor, naturopath, functional medicine person, whoever. Okay? I call this back and bloat syndrome. It's very simple. Let's say this is you, and this is your lower abdomen, around the belly button. If your lower abdomen is bloated, it feels constantly full, if it's hard, if it actually hurts, but if it starts to stick out, the lower back is slightly curved a little bit. You'll see these kind of forward head positions, or the shoulders rolled forward, and people have this C shape. This is back and bloat. The lower back is curved a little too much, and the front is a little bit too bloated and distended, okay? I'm only going to talk about 3 major organs that are in your lower abdomen. You have your small intestine, your large intestine, and your urinary bladder. Those are the 3 major organs. Of course, you have soft tissue, connective tissue, blood vessels. The major organs that are there are large, small intestine, and urinary bladder. This is kind of my makeshift model of the spine. In acupuncture, each vertebrae represents a different place in the body. These represent what we call the internal organs, the zang fu. In the lower back, around L5, which is just opposite the umbilicus, or the belly button, that L5 area, you have a point that represents your large intestine. Down just a little bit more, you have a point that represents your small intestine and urinary bladder. So not only are the organs down here, but the correspondent points in acupuncture and chiropractic also represent these 3 major organs. You can palpate, feel on your own body right around the opposite side of your belly right now. Go ahead and tap it, press it. If they feel stiff to you right now, pay attention to what I'm saying. You're going to want to remember this. Put a hand around your belly button. If it feels full to you, if it feels stiff to you, if it feels different than the upper part of your abdomen, you may have back and bloat. Now, why is this significant? Well, these 3 organs are responsible for moving food through your digestive tract, your lower and upper digestive tract, deciding which is food to feed your body, which part of that is valuable, the fats, the proteins, the fibers, the antioxidants, the minerals and electrolytes. All of those things are going to pass through, as well as a lot of water. And your body's going to decide what is waste and what is food, what's nutritive and what's waste. Your small intestine does that. Then your large intestine moves a lot of that around. It'll move the food around, and it'll move the waste out of your body. Large intestine is also known as your colon, right? Okay, so when a person has back and bloat, they have this constant fullness in the lower abdomen. They have this constant push forward spine. Eventually that starts to push against the rest of the spine and limits the amount of blood circulation that you can get to your legs. It also limits the amount of blood supply that the nerves that control your lower body have to move your feet, to move your knees, to get blood to your muscles. So people have chronic things like hamstrings are tight. They're always stretching, forward bends. The quads are tight. The calves are tight. The psoas, the inguinal fold is always tight. A lot of people say they have stiff lower bodies. A lot of this comes from back and bloat. Please pay attention. Every autoimmune disease that I've seen in clinic, that starts with celiac disease, with rheumatoid arthritis, with interstitial cystitis, Raynaud's, lupus, you name it. Every single autoimmune case I've ever seen had back and bloat. Every single one of them. The back was stiff. They either didn't feel anything because it was so tight back there, or they felt pain just moving around. Anybody that has arthritis in the knees, in the hips, that's a common surgery too. Knee replacement, hip replacement, or in the ankles. Anybody that has plantar fasciitis, I can guarantee that person has back and bloat syndrome. Now, it gets worse for people who have autoimmune disease or people who don't have a strong immune system, because if you have back and bloat, odds are you have food that's just sitting there, not digesting, or you have waste that's just sitting there, not being eliminated, which can cause pathogenesis, which is the formation of bacteria, parasite, and fungus. I don't want to lose you, because I know in natural medicine, a lot of people talk about parasites. A lot of people talk about candida. A lot of people talk about fungus. They have you taking probiotics and glutamine, and none of that works. Trust me, it doesn't. Because what you have is a functional problem. These organs here, large intestine, small intestine, urinary bladder, have connections to all of the other organs. When the blood supply gets short because a muscle is tight, your heart has to work harder, your veins have to constrict to get more blood to these places that don't have an adequate blood supply. Your nerves are now kind of interrupted because they don't have enough blood supply to send and receive. So now it's forcing your nervous system to work harder, which may in turn cause your adrenals, your endocrine glands, to go into a state of fight or flight. And that may be as easy to detect as just looking at the bloated belly and the sway back position, that bow in the back. I have one woman who lives in Germany, and she's been diagnosed with a few mental disorders. She lives in a facility. I had her on the table. Her back and bloat was so bad that when I put my hands on the back of her waist, she couldn't breathe. She's trying as hard as she can to open up that front rib cage because that large intestine is so distended. Okay? Every single case of lower body weakness, and this is diabetes, which in our world is thirsting and wasting syndrome. Every case of diabetes, that person had back and bloat. The worse the bloating, the worse the diabetes. Now, let me give you a quick segue, because I want to teach you something valuable that you can do. In addition to feeling in your own body for tension in your back, moving around for stiffness, and for bloating in the front. This whole thing came out of a conversation with a friend who was in the bathroom, and we're having a conversation. It's bathroom humor. He says, you notice that anytime you take a dump, you just can move better? And it's so true. If you have back and bloat, or if you just have bloating because you haven't used the bathroom in a while and it's not even chronic, as soon as you void and go to the bathroom, as soon as it's out, you'll notice that your lower body is much easier to move, right? As I'm filming this, the camera person has yawned about 15 times, right? If you looked at, you want to jump in the shot? Come on. Come on. This is a perfect example. So this is Joy, if you guys don't know. Joy, do me a favor, go ahead and pick your arms up to about here. What do you guys see? You see that C formation in the back and the bloating in the front? Now, between the two of us, who do you think would have more energy? The person with less bloating. Thank you, by the way. Everyone's a little bit shy about getting their belly touched. That's better if you do your examination. So this whole thing came out of a conversation in the bathroom. The guy was saying, do you ever notice that when you go poop, it's easier to move? Absolutely. Okay, so things that you can do. I want you to avoid this. This is sepsis, not stepsis, not your stepdad's kid. Sepsis. This is when you go septic. And that's really what I believe has a major role in your autoimmune disease. What I want you to start doing in the morning is put your hand over your abdomen. And if it's stiff, then you're going to have to do something right away. There are going to be protocols here that we offer that you can't get on the internet. But what I'm going to need you to do is some lower body movement, doing deep squats. Use a door frame as they do in the Qilel or Jineng Qigong. Look that up. Qilel squat, Qigong squat. Start doing Qigong squats. If you have bad knees, maybe you can do deep lunges. But what you're trying to do is descend the rib cage, right? Sink the rib cage. And when you sink the rib cage, you'll be taking the pressure off of your adrenal glands, off of your kidneys. The rib cage is seated right about where the adrenals and kidneys are. So when you're in these deep lunges, what you're allowing to happen is you're really allowing yourself to go from this fight or flight state into this rest and digest state. I'm going to need you to be in a lunge for at least a minute. Work your way up. Get about 5 minutes. If you're doing squats, start with 10 squats. Work your way up to 100. If you're chronically sick and have chronic back and bloat, work your way up to 300. That's free advice. It's not a medical advice. Please don't substitute this for your doctor. We're going to put a disclaimer there. I'm late in the game. But look, work your way up to 300 because this is how I beat my condition. Okay? So this is something you can do. Put a little space between your ribs and your kidneys and adrenals. Allow your lower abdomen to descend. Allow the blood from the middle region to make it to the lower body and vice versa. Allow that blood flow to return back to your middle body and eventually your brain. That is not going to fix all your problems, but it will give that bloating and that back sway back at least some fresh blood, to help get you through your morning. You should think about it several times a day. If you can't do a lunge and you can't do squats, you can always do these hip rotations where you move your body around. You can always do these bigger, wider rotations. This is an abdominal rotation and this is a hip rotation. There's a lot more that you can learn. These are just simple things that you can do. If you have chronic back and bloat, my suggestion is this. Go see somebody who practices some holistic discipline that deals with internal organs and musculoskeletal concerns. Don't wait around. About 95% of the people I've seen over 20 years have had back and bloat to some degree. People who have chronic sinus allergies, you feel their lower back, it's stiff as a board. You feel the front, they've got that half moon shape. It's full, it's stiff. This is a common thing amongst many people. I believe this is a predictor of the early onset of disease. It might be there as early as 5 years old or throughout your whole life. Start paying more attention to this area. Look for back and bloat syndrome. Thank you for watching. Please send us a message. Share this with somebody you think this will help, and take care.